Ever noticed your dog scooting across the floor, licking their rear end, or suddenly giving off a strong, unpleasant smell? These can all be signs of anal gland problems in dogs, and they're more common than owners realize. I'm Lyndall from Vetster, and today we're discussing anal glands in dogs, why they can sometimes cause problems, how to tell if your dog needs them expressed, and what to do if they need help. As usual, all of the information in this video has been carefully reviewed by leading Vetster veterinarians. Alright, let's hand it over to the experts.
So what's actually going on back there? Dogs have two small scent glands located just under the skin, one on each side of the anus. Each gland sits inside its own sac. These glands produce a strong, foul-smelling fluid that's released in small amounts when a dog has a bowel movement. Dogs can also release this fluid when they're suddenly scared, stressed, or injured. While it's unpleasant for us, it's a normal form of scent communication for dogs. In healthy dogs, these sacs usually empty on their own when firm stool passes, which is why many dogs never experience an issue. So what happens when things don't work the way they're supposed to? Trouble starts when that fluid doesn't empty properly. As it builds up, several different conditions can develop. Some begin mildly and worsen over time if left untreated. But it's important to know that anal sac disease is rarely life-threatening. One common issue is impaction, where thickened fluid backs up inside the sac. Impacted glands are uncomfortable and can easily become infected. Infections of the anal sacs, also called anal saculitis, cause pain, swelling, and sometimes abscesses. Abscesses form when infection becomes severe and pus builds up inside the gland. Whether a gland becomes impacted first or infected first doesn't usually change how treatment is approached. If pressure and infection continue, an anal gland can rupture. This creates a painful open wound near the anus. With prompt veterinary care, most dogs recover well. Dogs can also develop tumors in or around the anal sacs. Some are benign and harmless, while others are cancerous. Anal sac cancer is considered uncommon, but the outlook for malignant tumors depends on factors like size, spread, how early they're diagnosed, and which treatments are used. So what does this actually look like at home? Recognizing the signs can be challenging because symptoms vary in severity and can also occur in healthy dogs. Most dogs with anal sac disease show a combination of scooting, redness, swelling, discomfort, and a consistent bad smell. They may lick excessively, seem uncomfortable when sitting, or show skin irritation around the area. In cases of rupture, an open wound may be visible. When cancer is involved, there may be a noticeable mass near the anus, along with more general signs like low energy, swollen lymph nodes, abdominal pain, and reduced appetite. So how do vets figure out what's going on? When veterinarians suspect an anal gland problem, diagnosis usually starts with a physical exam that includes a rectal exam. In many cases, this alone is enough to identify abnormal or painful anal sacs. If more information is needed, additional tests may be recommended. These can include blood work, imaging such as X-rays or ultrasound, bacterial testing of anal gland fluid, or a biopsy of the anal sac or nearby tissue. Because the symptoms overlap, it's important for a veterinarian to determine exactly what's going on so the right treatment can be started. So what does treatment usually look like? For impacted or infected anal sacs, the first step in treatment is usually manual expression. This helps empty the glands and relieve pressure. However, this should only be done under veterinary guidance, since expressing them incorrectly or too often can make anal gland problems worse. Depending on the diagnosis, treatment may also include antibiotics, anti-inflammatory or pain medications, flushing the anal sacs, or lancing and draining an abscess. In recurring or severe cases, surgery may be recommended. This can be the best option for dogs with frequently impacted glands or tumors. In cases of cancer, chemotherapy or radiation therapy may also be part of treatment. Anal gland surgery does carry a risk of fecal incontinence, which is why it's typically considered only when other options aren't effective. An important note about home care: in healthy dogs, regular anal gland expression isn't usually needed. Routinely expressing anal glands at home isn't recommended unless a veterinarian specifically instructs you to do so. Even when glands are healthy, expression can be uncomfortable and unsafe if a dog doesn't tolerate it well. Most owners leave anal gland expression to veterinary professionals or trained groomers. Instead of routine expression, the focus should be on managing underlying issues like chronic soft stools and addressing medical problems early. If regular expression has been recommended, a veterinarian can show you how to do it safely or help you arrange professional care. So why do some dogs struggle with this more than others? Some dogs are more at risk for anal sac problems than others. Anal gland issues such as impaction, infection, and rupture are very common in small and toy dog breeds, and less common in larger dogs. Dogs that are overweight are also at higher risk. Other contributing factors include low-fiber diets, chronic loose stools or constipation, and food allergies. Anal sac tumors are most often seen in middle-aged to senior dogs. While any dog can develop anal gland cancer, certain breeds are affected more often, including Spaniels, Alaskan Malamutes, Dachshunds, German Shepherds, and Golden Retrievers. These tumors occur equally in males and females, but dogs that haven't been spayed or neutered are at higher risk. If your dog is showing signs of anal sac disease, or you're unsure about expressing their glands at home, veterinary professionals can also help through virtual appointments with Vetster. To wrap things up, healthy anal glands don't need routine expression, and most anal gland issues are uncomfortable rather than dangerous when treated properly. Because many signs can look like normal behavior, veterinary guidance is essential. If your dog is experiencing ongoing scooting, discomfort, swelling, or strong odors, a Vetster veterinarian can help determine what's normal, what needs treatment, and what the safest next steps should be. Thanks for watching. We'll see you in the next video.